Um, really intense anime stuff. Sorry about that. But yeah, a lot of my patients have been sucked into porn on anime. And then, that's I deal with a lot of
Tell me a bit about, first of all, what you do and kind of, I know you work with kids, but tell me kind of what you specialize in.
Okay. So I am a pediatrician and I specialize in kids now 26 years and younger. My specialty are actually kids with disabilities, especially autism, um, because I have a son with autism who's 29. And I have been a pediatrician for 30 years.
Mm. And you've been living in a place where you've seen a lot of kids coming in the last year or so. You were telling me about that. So tell me how
Mhm.
the kind of COVID situation has affected your patients, or even the type of patients you have. Tell me how that has been.
So, a lot of my patients who have been home, and fortunately, we live in Florida, which is an open state. But during the lockdown, um, I did talk to a lot of parents, and I saw a lot of kids who were depressed and anxious. And the amount of kids who were being uh, Baker acted, or in California, it's called a 5150, but it's an involuntary admission to a psych ward, has gone up exponentially.
And how
Yeah,
have
kids are, oh, go ahead.
I was going to ask how have has that been on, like, have you been just kind of swamped with that? Has it been something that's
Yeah.
been hard to manage?
Yeah, it's hard to manage. It's extremely stressful. So, from my end, because uh, there aren't enough mental health facilities around to treat all these kids or to take them in. And for instance, I could have a kid who's uh, suicidal, right? And so I'll try to get him into a facility, and we have to look all around Northwest Florida to find one. And that's really stressful for not only the patient, but the parents and me. And then to just start them on meds, it's like putting a band-aid on a huge problem.
So meds aren't the end all solution. Obviously, they need therapy and I guess a
Yeah.
lifestyle change.
Yes.
Have you noticed? Is there a common kind of issue or thing that's maybe leading to, and maybe that's hard to say, but I'm wondering if there's a common theme amongst a lot of these patients.
Yeah, it's isolation.
Okay.
Isolation. So the parents aren't home, the kids are at home, and they're supposed to be doing their online schooling or whatever that means. And then they get online, they get on all kinds of social media, which is telling them that they're not worthy. Um, you know what I mean? It's like this kind of rat hamster wheel where it's like they get on it, they're home, they get on social media, they're not good enough, they get depressed, they want to kill themselves. That's the usual scenario.
And what age range? I know you said that you deal with kids under 26. What age range
Right.
are these kids typically coming in?
These kids are typically middle age or middle school to high school seniors.
Oh, okay, okay. And is that something you would expect to see amongst that age range, or is that atypical?
It's atypical in the amount of patients I see with this.
Mhm.
The other thing that's happened is that a lot of kids who are high achievers are really anxious because They haven't had classes. Everything's disrupted. They, they're not fulfilling the criteria to get into really good schools. And so they're super depressed.
Mm-hmm.
Yeah.
How do you think, you talked about isolation. How does that sort of affect a developing child's psyche or even an adult psyche over time? And why does it lead towards depressive states?
Yeah. So, I mean, all you have to do is look at, the data on any kind of, you know, um, repressive regime where people are put in solitude, like in, I don't know, the Gulag or any of those kind of countries. It's hugely depressing. And these poor kids, they're at an age where they're incredibly impressionable. So instead of looking to their parents for guidance or anybody else in the community, they're looking online. And I know that I'm on a YouTube channel right now, and I apologize for that, but I have to say that what's out there is not realistic. And so if you're isolated and you're looking at this stuff, especially if you're a girl, by the way, and you're looking at all these I don't know, like makeup YouTube videos and all these things that tell you, you got to put all this stuff on your face to make yourself acceptable, or just stuff like that is like ridiculous in the effect that it has on these kids' brains. And their parents are like, they're gone, they're working. And I have so many parents tell me, I'm not a homeschooler, I don't want to homeschool my kids. So they go to work and then they expect their kids to get all their work done during the day.
Mm-hmm. Has it been between males and females? Has it been one or the other mostly, or is it kind of an even split?
No, it's females mainly for me.
Why do you think that
Yeah.
is? You mentioned a little bit how they're affected differently, but
Oh yeah. Now males, especially here in Northwest Florida, which is incredibly sports oriented, if they can't get out and work out or be with the football team or the basketball team, then they get really depressed.
but
Yeah.
maybe there's less outlets for females, it sounds like.
Yes. Yeah.
So they kind of rely more on those social media and internet based things, which
Those really plastic people. Yeah, exactly. But I have to say that kids who are grounded, like if their parents really take the time to raise them right, and they're grounded and, have something else beside themselves to look at, or have more of a service oriented mindset, those are the kids that do well.
You mentioned that you work with, you kind of specialize with autistic children. What special challenges do they have amidst this kind of remote learning, online school environment, and with staying home more? Do they have an extra set of challenges that
Yes.
neurotypical students don't?
Right. So online schooling does not work for kids with autism. And so, but to go to a school, they have to wear a mask. So I've written so many notes that say, please do not insist that that child wear a mask because it's ridiculous. And, but yeah, they get really agitated. They want to be, believe it or not, well, I hate to say believe it or not, but they want to be around their peers. They want to be with their teacher. They don't want an interruption in their schedule. So I just advocate for them to go back to school. They don't have to wear a mask. Kids do really well with COVID. It's a big fallacy to say that they're going to die from it because they won't. And I mean, it's just, it's ridiculous what's going on right now.
Have you dealt with any cases where it was I mean, I guess you can't get into specifics, right? Because it is kind of a patient privacy thing. But I wonder if you could sort of give any vague accounts of like just particular stories or instances that were alarming or unusual to you in regards to getting students who have these issues in the last year or so.
Yeah, I mean, so I've had a few kids with autism who have decompensated in the classroom because they've had to wear a mask. Uh, and these are the ones that I've had to write a note for. I've also had some other ones who have been Baker, not kids with autism, but other kids who have been Baker acted for depression and anxiety. And when you get Baker acted, you end up in a psych ward for 3 days, 72 hours. Um, and then sometimes it's more depressing than your actual life. Um, but the kids with autism or any kind of developmental delay, to insist that they wear a mask is insanity. And all I can say is thank goodness we live in Florida, where people have a lot more sense and a lot more latitude for allowing some kids not to wear a mask.
What are the effects of a mask? I mean, obviously you're covering your mouth and part of your body language is restricted in that regard.
Right.
What is that really? I feel like we don't quite know the long-term effects fully of that, but what, based on your kind of like professional opinion, like what do you think that does, I guess, to them?
So kids with autism generally have sensory issues, and a lot of that has to do with touch. So they don't want things touching their face. They don't want change. It makes them super agitated. And then they come to see me, and the parents want me to increase their medications. The other thing that I've noticed is that, as a pediatrician, babies like are seeing kids or seeing adults with masks. So they don't see the whole face. They only see the eyes. And so, like, what is that baby? What is that baby learning? All you have to do is look at the studies that were done years ago on, monkeys that were brought up with people with no facial expression. It's ridiculous. And, I had COVID. So, I mean, I know the dangers, I know all of that. But there are certain circumstances where, masks and the militant Nazi adherence to that mask rule is not, it's not warranted.
Do you think, regarding kind of the mental health resources we have, whether it's in Florida or just in the country in general that you know of, where do you think we are in terms of even being able to reach kids who are struggling with that kind of thing? I mean, do you think we have, yeah, like kind of what is the state of mental health resources in even dealing with such a problem that we have right now?
It's so bad right now. It's so bad. In the whole state of Wyoming, I think when I read this 5 years ago, there was one child psychiatrist. Here, even in Florida, our resources are just stretched to the limit. So even if you're suicidal, you can't get an appointment with a psychologist for like a month. Otherwise, you go into our psych facility, which is overrun, and then you have to be shipped to Panama City. And, it's so broken. The whole system is broken. So to inflict this on kids, plus, so here's the other thing I was going to say. The other thing that kids have to deal with today is the state of our whole world, where everything is like so negative. And, we're on the brink of war, brink of whatever, it's just like, just hideous negativity. I can't imagine growing up like that.
Hmm. Yeah, kind of just being bombarded with negative information and news constantly, especially on the internet.
Yeah,
Yeah.
exactly.
What changes would you like to see? And maybe it might be difficult to answer this, but like, what do you think is needed for better mental health resources?
People who want to go into it for the right reasons. Honestly, I can't imagine going into mental health unless you really want to help people because it's really, really hard. Um, just more people that want to do that.
Mhm.
I don't know. I mean, I don't know. You know, psychiatry and medical school was like the least favorite residency. Um, Mental health is really hard. To me, it's harder than like physical health, you know, and I hate to say this, but honestly, sometimes in a day, like most of my kids have mental health issues. And so when a kid comes in and he has like a strep throat or urinary tract infection, to me, that's really easy. That's so easy. Even if they had like, I don't know, pneumonia or something like that. But mental health is really, really hard. And it takes a toll on you as a provider or doctor. And, you know, I can only imagine the toll it takes on the patient.
Have there been any patients you've had who maybe you've noticed a big upswing in their mental health or in their lifestyle, and if so, like what did help them? But first of all, has there even been like any success stories? You know, people kind of
Oh, yeah.
okay,
Oh, yeah.
and what has
Even
been?
apart from this whole thing. Oh, yeah. So I've had a lot of patients, and you know, I don't know what the angle is on your podcast or whatever, but I am a Christian, and so I preach Christianity. I don't preach, but I truly believe that a belief in God and belief in Jesus Christ is like the way to go. I mean, that sounds really flip, but so most of my patients who have had successes, I've treated, I've talked to, and they have a belief in something greater than themselves.
And that's kind of
Because,
what keeps them going, or
yeah, yeah. And so when they see that I am like that, because I tell them about my struggles when I was younger, I grew up in a very abusive home. I put myself through college with the help of one of my mentors and medical school, and you know, it was hard. It was super hard, but I made it, you know. And so I talked to them about that. I talked to them about my faith, and I'm very sort of open and honest with my patients. So um, I've had a lot of successes that way.
and what about in terms of activities or sort of lifestyle changes? What have you noticed to be effective in kind of dealing with kids who are just isolated all day? Is there anything?
Yeah, yeah, yeah. Get off the couch. Stop playing video games, and walk a mile a day to start with. You know, there's so many. I have a patient who weighs 350 pounds, and you know, it's like, come on. It's, you know, he plays video games all day, stays up all night. There are a lot of instances like that. But yeah, I mean, obviously, the obvious things are eat a healthy diet and exercise. But those are super unpopular because people want you to say, oh, no problem. You know, just keep doing what you're doing and you're going to feel a lot better. But that doesn't work.
Right.
Give me a medicine, give me a pill, you know. But it's tough. I mean, you got to do the right things.
Is medication the answer sometimes, or is that helpful? Like what is your kind of view on that in terms of dealing with kids who have a lot of depression and such?
Oh, yeah. So if there's a strong family history of depression and anxiety, then they are helpful because it's more of a genetic sort of neurotransmitter related disorder. And so in a lot of those cases, medications are very helpful. But, oh, and also, so I see a lot of kids who are at this home here where they were born to biological parents who were either drug addicts, prostitutes, or drug dealers, and then they were in the foster system. They were adopted, and then the adopted parents couldn't handle them, so this home takes them in. So I'm like the resident physician, and these kids, a lot of them need medications because what led their parents to drug addiction was like bipolar disorder or something like that. In those kids' cases, then medications sometimes are really warranted, but sometimes it's just lifestyle.
If COVID restrictions were to end tomorrow, if the whole country were to be, let's say, like Florida, would you expect for the kids who kind of have been struggling with this last year, do you think there would be even long-term effects, even if things were to go completely back to normal? Would you expect there to be long-term effects and maybe trauma or something like that in these kids' lives, even just from what we've already experienced?
It all depends on their parents. It depends on, like, if their parents taught them to be resilient. Resiliency is something that I really believe in, because if you don't have that, you're not going to make it in life. So if their parents taught them, hey, listen, this is a rough go. We're going to get through it. You're going to be okay. Those kids are going to do fine. But if that's not in their life, then yeah. And I don't really believe in using stuff like that as an excuse, because then you make yourself a victim for life.
Mm-hmm. It is interesting though, because I actually interviewed this teacher in South Korea, and he was saying that the students there, a lot of them were younger elementary school kids, were actually doing pretty good compared to the US at least. And that's because in Korean culture, there's a strong emphasis on like discipline amongst the students and kids and in the family. And so I think what you're saying is kind of related to that, is like the resilience and the discipline to withstand something this, difficult.
Yeah, I totally agree with that. And that's why in our culture today too, by the way, on social media, so many people make themselves victims or targets of some sort of discrimination or something like that. And I don't really 100% buy into that, because the minute you do that, you're just making yourself weak. And I think that if you want to make it in life, you had better, I sound old fashioned or whatever, but just pull up your bootstraps and just do it and stop, whining about it. Mm-hmm. Some people have an absolute horrific life and whatever. But overall, I would say that in the United States, I've been to other countries where the poverty is like so ridiculous. We have nothing like that here. Do not make yourself a victim. Just get out there and do it.
What would you say, or what general piece of advice could you give to someone who is maybe in high school, in Zoom classes, lacking motivation, grades are down, kind of does not have a very active social life, maybe their parents are unattentive, somebody in that kind of situation that typically leads to this kind of depressive episodes and such? What are some steps they can take to kind of keep themselves from getting into a bad place?
Well, I know, what we do and whatever. I would say get a small group of people, if you have to do it on Zoom or if you have to do it, with masks on somewhere in public, and meet regularly. So I'm in a Bible study group, and that's what we do, which is my saving grace. But kids, unfortunately, they're role models online, and I'm not. This has nothing to do with you, but they're so like out of the realm of reality. Kids need consistency, they need love, and they need affirmation. You don't get affirmation online. People don't know who you are. They'll say anything, you know what I mean? And so, like, people commit suicide over the stupidest reasons. But I would say stay grounded in God, and I have the beauty because let me just explain. I am a direct primary care physician, and so I have my own practice. I'm not bound by any insurance companies because I think big insurance is it's horrific. But anyway, so I can say whatever I want to my patients, and they really enjoy what I tell them because they want to hear the hard facts. They want to hear the truth. So if you have a kid who's like that, who's suicidal, I bring in the whole family. I bring in the mom, the dad, and I kind of read them the riot act about how they have to make this kid understand that they need to stay grounded in something besides themselves. They need to have a small group of friends that they communicate with all the time, and they need to stay off certain websites. Mm-hmm. Particularly really intense anime stuff. Sorry about that. But yeah, a lot of my patients have been sucked into porn on anime. And then, that's I deal with a lot of really severe situations.
Right. Yeah, that sounds like some bizarre situations, of course.
Yes.
What do you think are, I guess there sounds like there's maybe some misconceptions in the more general sense. Like, I feel like people haven't really caught up to what you're experiencing and what you're dealing with when it comes to these kids, mm-hmm. and the effects of whether it's masks or Zoom classes and all that. Yeah. So like, yeah, what would you want to speak to as a big misconception of something that people don't understand or they're not paying enough attention to, that you would want to kind of highlight in regards to mental health and all that?
Parental neglect. And by that, I mean, it can range, it's a gamut. It can be like a meth addicted mom and dad, who I see a lot of, by the way. Or it could be like somebody who's like so into their social status that they are like out all the time, or their job takes them out and their kids are left alone. Kids need parents. I don't care, what anybody says. They need a mom, a dad. They need affirmation, like I said earlier. And they need someone to tell them, hey, you're going to make it through this. So to me, resiliency, because I see that disappearing. We have so many people that are just like victims. And, you can't, I don't know, you can't go through life like that. They see it on the news. They see it on social media, all this stuff about discrimination and all this kind of stuff. I'll tell you, it's up to the parents.
So it sounds
I blame it.
There is.
Okay.
It sounds like you're getting at maybe there's familial issues greater than just students themselves. There's familial issues that are now creating the situations in a way.
Oh yeah. Holy cow. Yeah. I mean, I was blessed because, my husband and I are both doctors, but I made it a point that my kids would not be in daycare. They would always be at my office. They would always be with me. I mean, I know a lot of parents can't do that, and I get that. But you need to make your kids feel like, to you as their parent, they are one of your most important things on earth. And I see a lot of kids who never get that. Never get that affirmation.
Mm-hmm. Yeah.
And I'm not a bleeding heart liberal or anything like that. It's nothing like that. It's just the way things should be. You have kids, you take care of them, you raise them, you provide for them, and you send them out in the world. But talk to any pediatrician, they'll tell you it's like so dismal. Not all the time, but a lot of times it is.
Mm-hmm.
Because the people who come to me the most are the people who have problems. I mean, sickness is one thing, but all these mental health issues, yeah, it's either genetics or parent created.
Mm-hmm. I think that covers my questions. I appreciate your time, Dr. Mahaffey, and I think this is an important perspective for people to hear. So
Yeah.
I really am thankful that you shared this with me.
Well, thank you. Thank you for having me on. I appreciate it.
Yeah.